Namaste and good evening. I thank each and every one of you from all over the world who's taken the time out to attend this webinar. Even the just passed MBBS doctor knows that for treating diabetes, the first thing is nutrition, then comes stress management, emotional security, physical exercise, and yoga. Only after all this does medical treatment start. Now, this word, reversing diabetes, is being bandied about in the social media. Senior doctors have to come out and they have to write articles on it in various media. Very often, doctors don't step out, into the limelight to clear doubts for the public and for patients. We are sometimes lost in our own practice. So when SafeGuard approached me, I very happily said, yes, the time has come to clarify a lot of truths on this. I will be presenting a lot of medical slides, but the explanation will be in simple English so that everyone can understand. The thing is, I have only one request. Each slide which I present here is potent with a lot of information and many questions can be asked. So I humbly request the audience to hold your questions till the end so that I can take them one by one at the end of the lecture. I'm basically a cardiac diabetologist. For many years, I've been working in cardiology as registrar. And then we did a course in diabetes, and I've been working in a corporate hospital as a preventive cardiologist. And I have my own clinic as well. So with that, today, all over the world, this particular trend of cardiac diabetologists is catching on. So that's why this topic. Now, if I may start off with my slides. The first thing is people need to understand that diabetes is of more than 30 subtypes. Okay? There are many classifications, first of all. Let me take, for example, what happens in India typically. Two people are traveling in a train. They keep talking to each other. Your doctor said this, my doctor said this, my diabetes tablet is this, your diabetes tablet is this. This goes on and on and on. And when the train reaches its destination, a doctor nearby comes and says, sir, I listened to your whole conversation last night, but your diabetes and his diabetes are not the same. So the problem is we think diabetes is one disease. The other thing that we have as a misconception is that sugar is diabetes, because you can have temporary elevations in sugar in many conditions, including drug-induced diabetes, where you might have to have higher sugar levels for some time, like for steroid use, etc. And later on, it subsides. So sugar elevation does not automatically make your diabetes as a diagnosis. Another thing is you might have diabetes, but your sugar may be low, maybe because of tablets, because of infection, because of so many conditions. There's one more myth going on. Sometimes in pancreatic diabetes, the enzymes are not secreted by this organ. So we tell the diabetic patient to increase their carbohydrate and decrease the protein because their body's digestion is affected. So there are many permutations and combinations for various kinds of diabetes. You got to understand that. But here, for the purpose of this webinar, I'll talk about the common adult type 2 diabetes, which is more than 90% of the diabetes in India. And for this webinar purpose, we'll call it as adult diabetes, which everybody has. A little bit about the evolution of diabetes for you to understand my lecture. The first mention of diabetes was by a physician, Hayes Ra, Egyptian physician, in 1552, and it was found in the Eberes Papyrus of Egyptians. The 5th BC Ayurveda mentions Madhumeha as diabetes, which means honey urine. In 1674, the English discovered it. Thomas Willis called it diabetes for the first time. In 1921, insulin was discovered, which was the first step into treatment. It was by researchers in Toronto University. Why have I said all this? Because, see, we have made it colloquial, the description of the disease. So the Tamil-speaking people of India call it Sakkare Noi, which just means sugar disease. The Hindi-speaking people call it Madhume, which means sweet urine. Now, misnomer in India is a basic problem. Okay, diabetes does not equal sugar. If you can understand this, the rest of the lecture will be easy. The common adult type 2 diabetes is a confluence of multiple risk factors. Okay? The priorities in treating adult diabetes is first detect all the hidden risk factors and the dangers. Okay, keeping you safe is the first priority. Second comes preventing the complications long before they can happen. Okay, today we have technology to do that. And then comes sugar control. I'm not saying sugar control is not important, but don't forget there's much more to it than this. The major components of an adult diabetes, basically there are 6 chemical abnormalities. One is sugar, and then of course salt and BP, that is cholesterol, thyroid, vitamin D, and calcium. Okay, so you can't take just sugar and treat it and say your diabetes is under control. The next thing is the adult diabetes variety affects commonly 6 organs: the heart, kidney, brain, eyes, your leg arteries and nerves, and the bone and joints. Now they call it a silent killer. Why? What happens silently? Now, if you look inside the blood vessel, the artery is clean when you're born. Okay, slowly, you can have 1 or 2 plaques in between, but as you form a nidus here, I'm pointing this out with the cursor. As you form a nidus of cholesterol here, that forms the foundation on which, if your lifestyle is not controlled, you can form a plaque or a block. Okay, so that's the cholesterol block. Now, on top of this, you can get calcium mixed in it, and it becomes a complex block which can rupture and cause problems. So, slow, silently, what happens in the body, when you see this particular photograph of a normal artery, the blood flow is nice and wide. As the blocks develop, you'll find that the blood flow is compromised. So, this is the silent pathology that goes on in your body. Now, what is the dreaded outcome of this? When the block to the heart is affected, you get a big block, you get a heart attack. Same way, the circulation to the kidney can, get compromised. You can get kidney failure. Same way, brain stroke, loss of vision. The feet, silently, you can have loss of blood to your feet. Okay, oxygen can go low. The skin changes of the feet can happen. Now, when this happens, sometimes you also get nerve damage of your feet. There'll be burning sensation, there may be pain. When both of these get really, really bad and progresses, sometimes your feet can go numb. Okay, when your feet goes numb, it does not mean that the disease is gone. It's not reversed. It just means that the nerves have stopped conducting, which is worse off. You got to be more careful and take more care of the feet. When these two progress to a certain extent, you might develop an ulcer. This ulcer does not get enough blood flow. The tablets may not reach it. Oxygen may not reach it. Pain will not be there. So it might become deeper and deeper. So very often, to prevent a complication in the leg, we have to cut the feet, which is called amputation. Many people are not aware that other than all this, the multiple joint problems that you have in adult diabetes is also part of diabetes. Now I'm going to digress a little bit here. Saving lives through advanced prevention. Okay, so earlier on, the doctor who used to treat was a doctor who used to treat during illness. Okay, this was the definition of a doctor some time ago. Now, then came MD physicians, medical physicians. They were primarily doctors who could save lives in complex situations. Okay, these were the stalwarts. Those days used to have, Dr. B.C. Roy and that kind of a, era, where people used to be physicians to prime ministers, to the politicians, to big shots, to all this came through with MD physicians handling complex situations. It was referred to them usually. Today, MD physicians all over the world have gone into the role of running ICUs, because there's no only cardiac or only neuro or stroke or leg or trauma ICU. So the ICU has come under MD physicians. Now came the era of experts. Experts know 100 things about one subject. It is necessary, it is research oriented, and you go deeper and deeper into a subject. But then savior is also important. The savior must know many things about 100 subjects to save lives. Cardiodiabetes is one such multi-expertise prevention. What is cardiodiabetes? For you to understand, I'm going to elaborate a little bit on the slide. Basically, it's early detection and prevention of complications. You can identify and correct all the associated abnormalities I've mentioned earlier. All the silent killers can be detected. There is no need for you to end up the complication, because the complication first gives a warning and then it comes. You can detect these complications 5 years before it can actually happen. So why end up with a complication? You can have a happy old, aged life if you put the weight on cardio diabetes rather than only sugar. Now, cardio diabetes uses multidisciplinary, high-end, advanced detection tests. Okay, can prevent blocks. It can do cardiac rehabilitation after putting in a stent and a bypass. It needs maintenance, and you can prevent reblockages. Now, just for example, I won't tell you about heart and retina and brain and kidney and everything. There are so many high-funda tests. Just let me explain. Before an angiogram, you can detect a heart disease by an echo or an ECG or a treadmill test. Okay, it can show the block is developing before it actually gives you a problem. The same way today, we have even mobile technology coming in where can look into the eye and look at the artery directly and find out if there is a trouble brewing somewhere else in the body. When the eye is affected, generally it gives a warning that the microcirculation of the kidney is also affected. So there are so many ways of detecting that there is going to be a problem and preventing the same. Now, how to understand the reversal concept? This is our topic today. Okay, you need to understand three things. One is the natural progression of diabetes. Second, the actions that alter the natural progression of diabetes. And third, the difference between the word remission and reversal. Okay, so if you understand this, the concept becomes easy. Now look at this slide. That yellow part, that yellow arrow is where the sugar actually comes into your blood, starts elevating. Most people call that the green arrow is the 0 point when diabetes starts. But actually in the blood, diabetes can start before sugar is elevated. For some people, 5 years before, for some people, even 10 years before. That's where that red arrow, you can see the graph slowly increasing, but only when the sugar starts going into the blood as an elevation, do you call it diabetes in layman's language. Okay. Now, you cannot go and fight with the doctor saying, how come my diabetes is only 5 years old? And, even with good control, I'm getting this complication. Whereas that man had, diabetes for 10 years and he's not got a problem, because there's something called a pre-diabetes as well. Okay. Now, adult diabetes has got two genes. One where the sugar is seen in the blood, and the other one where the complications can slowly spread in the body. One person can have sugar more and ability to have complications less. Another person can have the ability to have complication long before the sugar becomes a major problem. So you got to please understand that. Now, how to alter the natural progression of your diabetes? One, in 2014, there was a beautiful study on the proper diet and exercise. If you follow, what happens? Okay. The red point here is where a person should be if he's had a bad diet and exercise despite having tablets. But with the proper diet and exercise, they showed that the red point can come down to the yellow point. This only shows remission. Okay, that means the complications are postponed. The number of complications are postponed. In other words, it's remission. It's just a silent presence of diabetes and slowing down of complications. It does not mean reversal. Okay, how do they quantify this? They quantify this by looking at the retina. Okay, that's why we have today retinal scans. Those days, to look into the retina, you had to spend 10 to 15,000. But today, you can go home and do the retinal scan and find out long before a complication attacks a diabetic patient. So that's one slide. The other one about diabetes altering the progression of diabetes is effect of weight loss. This is a very interesting slide. Look at the red line on top. As the person gained weight, okay, he's supposed to have only this bottom line here in the blue zone, where his weight is supposed to be according to his age. But as his weight gained more and more and more, sugar became bad. You can see by the red arrow. But even after he was put on tablets, when he lost weight, his tablets came down. Okay, this happens quite often, but nowhere do doctors call it reversal. Okay, it's like a snake has come into your house. Okay, it can cause a lot of damage. You caught the snake and you put it down into a box. It does not mean you reversed the problem. You just controlled it. That's what we mean by remission. The same study showed after the tablets were decreased, the person started regaining weight, because many people, what happens is when the sugar comes under control, they think, my diabetes is gone, I can do what I want. When that happens, they lose control of their weight, their diet and nutrition. And again, the graph you can see went to where he would have been if he had not lost weight. Okay, so it can bounce right back up and your tablets may have to be doubled. So this is one of the altering of the natural progression by controlling weight. This is well known to doctors. Now there's a very interesting study. When you have a block, developed somewhere in the major artery, can it be reversed? This is the question that we are facing today. Actually, they studied a patient. This was published in 2020. The heart artery, you see, the heart pumping blood to the brain goes via an artery called carotid artery, which you can see in the red line, and it can be easily studied through ultrasound. Okay. Now, they found two small blocks in the major artery in the neck of one person. I'm showing it in yellow, but it's not actually in yellow. I've colored it for your benefit. And the cholesterol may slowly build up over this small little block at the base and become a bulb. So after 18 months, they found a bulb had actually aggressively grown for this person. They gave anti-cholesterol tablets and they proved that you can reverse the block to a certain extent by cholesterol management. Okay, this is the famous reversal of heart disease that many people talk about. And today we are trying to extrapolate that into reversal of diabetes, which happened till today has not been shown. Now, I'm going to not talk about every single diabetes trial that's there out there. Okay, there are very many. We'll talk about the two world's largest diabetes trials. One is an adult trial and one is done on a child, and it's still going on. After 10 years, they published that lowering of your blood sugar can benefit you. Okay, it can postpone your complications, no doubt about it. But reversal has not been mentioned till date. So what is the difference? It looks like marketing entrapment. Okay, I'll talk a little bit about this later. Is it remission or reversal? Now, just because you go on a diet and exercise and nutrition, you can decrease the complications from the red dot down to a lesser complication, which is the yellow dot. Okay, but this is not reversal, this is remission. Reversal is a misnomer used by some to lure the gullible patients. Okay, you got to be careful about that. Remission is a slowdown in the rate of progression, and we all doctors have known this for many years, but we don't go about saying we will reverse your disease. So, doctor, what is new? You asked me. Only the social media marketing. Social media came, and we've been thrown into multiple waves of fears. And also right now, because of people are more scared in India, we are getting this reversal of diabetes being bandied about in social media. Okay. Now, I like to digress a little bit here about the misuse of this word. See, there was a book called Reversal of Heart Disease because cholesterol showed that a block can be slightly reversed in one particular artery, major artery. But whether this carries down into the micro circulation or small blood vessels inside your heart, inside your kidney, whether it actually has benefits there is still being studied. So Dr. Dean Ornish in 1919 published a very famous book called Reversal of Heart Disease. He had a lot of good points there. But when it percolated down to India, see, he talked about meditation, calmness of the mind. He talked about yoga. He talked about nutrition, a whole lot of things. He talked about oil. What India had said for centuries came into the limelight in the world. But then when the actual problem came to India, I mean, this concept came to India and was implemented, many lives were affected because it was over-marketed with wordplay. Okay, it's a dangerous thing to say, I can reverse your disease and giving a promise to a patient. Okay, so this is like conjuring up an act. Why I say it affected many lives is that time I was working in cardiology and we found a lot of people who should have by right had a stent or a bypass or some kind of treatment for his heart condition. They came and said, no, I've read that book and I'm going only to yoga and nutrition and I'm not going to follow this. And they were really affected. Okay, think about the families after you use words like this lightly. So that is one thing. The other component to this is when you make medical claims, okay, with proof, you have to publish it in trials, in reputed journals, not in the social media. Okay, we have one problem here. I'll tell you this openly. Allopathy doctors, we don't know what is being published in the Ayush field and what is the proof there. The Ayush doctors and some of the other parallel systems of medicine, including nutrition and all of them, they say, okay, you don't need tablets. I think we should reach an era where all these components are studied and put together to give the patient a benefit. No point going on blaming each other and then not having. But definitely, I can tell you one thing: we cannot use promises in the social media to get patients on board. That is a no-go area for any doctor. Now, how to truly achieve diabetic remission? The new concept which has started this whole debate, why are young doctors going around saying we will reverse your whole problem and all that? This new concept is you have to treat a patient not when they are ill. You have to treat them when they are well. Okay, this means when they're all right itself, you need to diagnose the problem. When they're all right itself, you need to control the sugar. When they're all right itself, you need to prevent any major change in the organal status of the person. Okay, so this concept is catching on in diabetes in a big way. Use quad method. Okay, there are 4 verticals which can be used to treat a person even at home. Okay, this quad method is using of psychologist for emotional security, using of nutritionist, using of medical doctors as well, using of ailment, physiotherapist. Whole lot of things are now coming into the squad method. Okay, that's another whole topic that I can discuss. I don't want to go too deep into that. You can use multimodal technology to detect and prevent complications 5 years before it happens. Okay, regular home checks are better than yearly hospital complications. See, we have had patients, okay, who start off on a wellness concept, saying like somebody came and told me, I need to stop all my medicines. I need to go only on this diet. I need to take only this magic pill or something like that. And then after some time, they come after 1 year or so when something is damaged. That's a wrong way to find out that you've been affected. Okay, the better, and even then, even if you are taking all your medicines regularly, you don't want to give too long a break to find out that you're holding that graph, towards wellness, and that there's no surprises going to come at the end of a 1 year checkup. Because at the end of 1 year, when there's a block, what do you do? The next step is totally different. So for that reason, we call it treating in wellness using the quad method. So what is this wellness therapy that I'm talking about? You can achieve remission. Okay, I'm not talking reversal. We already covered that topic. We can achieve remission. We can postpone all your problems. We can have a better lifestyle in old age by basically very crucial weight management. Okay. Another thing I'd like to touch upon is diabetes diet. I put in bracket tradition based. One thing I feel very funny is when you go to UK, okay, they eat fish and chips. That's the staple diet. They drink beer at night and go to sleep, including diabetics. You work around their diet and you create a diet chart for their conditions. Okay. Here, or you go to US, the cold climates, they will have a whiskey at night. Even in India, there are a lot of people who say, I need to have a whiskey, doctor, you give me anything, but it has to be within that. So what we need to do is find out what is the calorie requirement of a person. Okay, we have multiple cuisines in India. You'll have a Northeast cuisine, you might have a north of India cuisine, a south of India cuisine. All this put together, you need to have food that's comfortable to follow. We are going on parroting out what is written in the English textbooks out saying, I've seen people writing about diets that are miserable to the patient. He needs to live in his old age in happiness. So that's why I said a diabetic diet should not be just a blind diet. It should be a tradition-based diet. Okay. The third component is the emotional well-being. This is crucial. Okay. I will tell you from my point of view practice. Sometimes patients come and they come and tell me sugar is bad. I was referred to you. I come to see you. Simple question I need to ask them: are you eating well? Are you sleeping well? Okay. These kind of basic questions will tell you, no, doctor, I can't sleep till 2 or 3 in the morning. You touch that button, the sugar will come under control. Okay, man is a holistic being. Okay, you can't say the sleep not there, your sugar doesn't matter. Even if I don't sleep the whole night, my sugar and BP will be up. A doctor has to go beyond, okay, to looking at the illness and look at the wellness component. Regular micro exercise. Why I say micro exercise? WHO says that you have to walk for about half an hour for 5 days and it's more than adequate. Agree. But an elderly person is not able to do that. Today, in the eastern part of the world, they're doing Tai Chi. If you can't go out of your house, inside your house, there is yoga. Okay, only thing you don't have to stand upside down. Okay, places, there are many yoga institutes, even in Mylapore and Chennai, places like that, where they have yoga classes for diabetes control. Okay, it's basically flushing of your organs, more circulation, and recreating a good digestion flow. Okay, we can talk a lot about that when we come. We'll keep that for later. Do not depend only on medicines. Okay, this is what is being bandied about, saying medicines are bad. Medicines are not bad. The first 3 steps or the first 4 steps are already there, inculcated in the curriculum of every doctor who's going to treat diabetes. It's not something new. It's being presented as new. Okay. So once you cross all this, judicious use of medicine according to the diabetes, according to the age of the person is crucial. I don't deny that. Then detect and prevent complications, because after all, your family, your happiness, everything revolves around living without complications. Okay, one person might have a slightly higher sugar, he may live longer. Another person might have a very tight sugar. We even had a recent episode. Okay, went for a walk, came back with good sugars, and he collapsed. You can't fight. His sugar was normal. Why did he get a complication? So detect and prevent the complications. And very, very, very important. I've used 3 varies here. A family doctor is your best protection. Okay. Those days, a family doctor used to know your family. They used to know your ups and downs. The another thing is, in India and US, we walk in with a chest pain. Morning, you do an angiogram. Afternoon, you say nothing is wrong. By evening, you're discharged after some 30,000-40,000 rupees and saying this is gas trouble, take a Gelusil. Okay, we all know this happens. The thing is, you need guidance from a family doctor. In Europe, okay, in the national health services and things like that, why do they not have this problem? Why is it not so rampant like in India? Because under the NHS, there's a family doctor who will guide you. He'll write a letter. He'll talk to a physician before he admits. And the physician has to give a feedback, not to a family member and counseling, because you may not know. If they say, okay, I need to put a stent, you'll say, okay. You need to have a family doctor as a friend. Today, many family doctors are well versed in diabetes because that is part of their curriculum. Okay. So if you have this as a protection, I'm sure your entire family, not you, just your diabetes or your cardiac problem, you'll have very good guidance. We hope to bring this back in the next decade. Now, 3 points I'd like to leave you with. Don't get fooled. Point number 1. Reversal of sugar is not reversal of diabetes. Okay, it's much more than that. First of all, I'm talking about adult type 2 diabetes. We'll come to the other diabetes later. Even for child diabetes or pregnancy diabetes or pancreatic diabetes or all these diabetes, reversal of sugar does not automatically mean reversal of diabetes. Join a holistic wellness program that attains remission before you can end up with any other complication. That's the message of the day. Thank you so much.